and I started feeling, and then TMJ came into picture. I have to ask you, I mean, when you think of cervicogenic, you brought up the muscles and the upper neck and stuff, but I've also heard like TMJ. I've heard that this is related to it somehow as well, that there's a balance between the jaw and like upper cervical and the muscles. Is that somewhere like maybe outside of where you think is like the core, or do you think, because you hear a lot of stuff as a patient, right?
Yeah.
There's a lot of rabbit holes.
Good question. You're going real deep. So, uh,
Sorry, man.
to answer your question on that, there is someone normally will have some sort of overuse tension in the jaw when they're having an upper neck issue. It's just
Yeah.
if you kind of think of like rings on a barrel, if you point to the upper neck and you transverse that all the way across, you're going right over the joint from a fascial line standpoint. And
Interesting. Yeah.
I even tell people like if you imagine you open your mouth as far as you can, that should feel comfortable. But if you change your position and you kind of go in the forward head, like
Mm,
that just changes it based off of a mechanical change. So um, here is my thought on that. I would say if you're having cervicogenic dizziness and they're just treating the jaw, I think you're probably missing major piece
yeah. Sure.
of the puzzle. If you, some people, and the listeners can try this. There's sometimes there's a technique that I do, and most people have, and instead of you doing like a dry needle to the suboccipital, sometimes there's this thing called a suboccipital release, and you can put
Mm,
a practitioner put their hands there on the back of the skull, and it should be keep your hands there, like open me up in
yeah.
cases like this, and it happened twice this morning, when I put my hands there, it may be like I can't relax, or that pain, instead of it being just a little gnarly, like if you have a scale 0 to 10, 0 being no pain, 10 being like sharp stabbing, this is worst imaginable. I like for it to be a little gnarly, like, okay, you're getting into something, right? But one of my strategies and data points we go at is like, does it relax? Does it open up? And
Yeah.
what I'm getting to is that a lot of these people are like, that's not going to feel as comfortable. Now you can kind of override it a little bit with dry needling, which I think you had in it, and it kind of just gets in there. It's a little bit more painful, but some
Yeah.
practitioners states can't do it, or
Right.
and that's a not many PT. I mean, some PTs still do it up there, but you're getting into the nitty gritty, and some people just don't feel
Yeah.
comfortable with it. But what I'm getting to is the clinic, the people listening stuff. They can go and do some masseter releases here, which masseters the clenching muscle.